I think the only regret I have on that engagement is that we didn't make the case well enough to the people of Oregon and to the powers that be of the value add to Oregonians and to the Oregon healthcare programs of us combining with SCAN. We believed then, and I believe now, that it would have been exponentially more valuable to Oregonians to have us as a part of Health Right Group, which we're looking to create with SCAN, to provide better, more comprehensive care to our members, to have greater scale, to get better deals with pharmacy vendors, to have greater access to, through combined efforts, to stand up programs in AI or cyber technology that would let us serve people better, to learn more about how to more adequately manage our Medicare Advantage program, in which they are expert. They're a 4.5-star Medicare plan. We're a 3.5-star Medicare plan. That 1 star is critical benefits that aren't getting to beneficiaries, right? Because of that. They could have helped us do that. They've got work they're doing in California in Medicaid where we could have helped them. So I still believe it was the right thing to do. It would have been good for Oregon. The only thing I regret is we didn't make the case well enough to sell it. Are we looking for partners still? I think those same challenges we had then exist, but we have truly learned that because of our unique role in the fabric of Oregon, we truly, in some people's eyes, are considered a public utility, which we value and appreciate that role we play as the safety net of the safety net, really the largest Medicaid player in Oregon, serving the most vulnerable. So we understand the need to have anything else we think about, first and foremost, protect that work, right? And I think that if there are partners out there that will help us enhance that work, where maybe we're the lead dog in the Iditarod instead of just one of the train, right? Or we've got partnerships or joint ventures. Those kind of things are always things we're looking at, because there are so many needs for our members and our communities. There's only so much that even we can do by ourselves. There are things that people do better than we do, and we need to identify those, because as we started the conversation, there are greater challenges coming, and the more nimble you can be, the more diverse you can be, the better off we'll be, and the easier it'll be to serve our population and our communities. So, we are not shying away from opportunities, but we're going to be very deliberate moving forward. And like the SCAN deal, any partnership would have to be rooted in like mission. I appreciate my for-profit brothers and sisters, but that's not the world we live in. And so any partner would have to have sort of a similar sensibility of serving communities. I think as far as mistakes, we have, as I mentioned earlier, we're seen as a bit of a public utility. And if anything, I wish that I had been more forthright and aggressive in identifying ways in which we could partner with sort of provider networks to form more lasting coalitions. Frankly, we have a tendency to be Switzerland in the healthcare environment in Oregon, right? And we don't have a hospital to feed. We don't have shareholders or dividends to pay out. We have a dedicated board of community directors that drives our work. But there were opportunities to forge a stronger bond with, not necessarily a partnership, government merger kind of thing, but a stronger bond with some of the provider systems that could have been beneficial to both of us. We've done our own thing primarily, and so I think if there's any regret, it would be that. But I think I'm just so proud of what CareOregon has done over the years, and it's not even remotely just me. I've got an amazing team. Most of my C-suite was here before I got here, Right? We've added some new players, but we are probably 3.5 times as large as we were when I got here from a revenue standpoint. We have 3 times the membership. We've got new lines of business, like I mentioned, house call providers doing palliative care, hospice. We've got a number of things that we've done in our communities, which I think I'm most proud of. Is we've gone above and beyond just providing health care. I say all the time, and I prefer that we don't even refer to ourselves as an insurance company. We're a community benefit organization, right? We are not based on underwriting. We need to make enough money to keep the doors open and to do good in our communities, and we've been successful at that. And it's allowed us to buy the former Red Lion Inn in Seaside, Oregon, and convert that to supportive housing, transitional housing for our members on the inside, in the hotel part, and use the motel part to provide short-term temporary housing to caregivers trying to move to the Oregon coast who can't find a place to live. Right? Those are the kind of solutions that I'm proud of our team for pulling off. We have invested in our communities in ways that most companies like ours would not do, because we truly do believe that healthy communities make healthy individuals. So we've invested in the Boys and Girls Club in a Rockwood portion of Portland. A lot of our members live there, and it wasn't just putting our name on the building. It was meaningfully engaging with them on programs around early childhood education, around food and nutrition, about community empowerment. We even went so far as to sponsor the Portland area Starlight Parade, which is part of the Portland Rose Festival. It's a quirky, very Portland kind of parade, but it's geared to bringing the community together, particularly downtown Portland after the turmoil of the riots and COVID. We thought it was important to help elevate our communities. And those are the kind of things that I'm most proud of. It's our engagement in our communities and serving so many people and doing right by them, I believe. Supporting our provider networks during COVID. It wasn't just with dollars that we moved into our provider communities to keep them afloat until COVID started to subside and people came back in for care. It was engaging with the state and partners to use our pharmacy expertise on vaccine distribution. It was using our behavioral health expertise to not only identify needs in a broken behavioral health system, but to actively move to increase capacity and access and invest in those providers and communities. So yeah, I could ramble on and on about the work that this team has done. And we just celebrated our 30th anniversary. So we've got at least 30 more to go, and hopefully it's as meaningful. If we continue to grow like this, then we'll have everybody on Medicaid in Oregon, and I'm okay with that. But again, I also hope that the world gets to be so we don't need so many people on Medicaid. Right? They make a living wage. They can afford insurance outside of the government programs, and they're happy and healthy. And we're serving the most vulnerable, and that's an ultimate goal.